When it comes to children's health, one size does not fit all. Children are not just small adults. Their bodies and minds are constantly changing, requiring a different approach to healthcare at each stage of development. Age-specific pediatric assessments are crucial for accurate diagnosis and treatment. By understanding the unique physiological and developmental milestones of each age group, healthcare providers can tailor their approach for the best possible care. Imagine trying to use the same vocabulary and explanations with a toddler as you would with a teenager. It simply wouldn't work. Similarly, using the same assessment techniques for a newborn and a school-age child could lead to missed diagnoses or unnecessary tests. Age-specific assessments help us to understand what's normal for each stage of development, allowing us to identify potential problems early on. These assessments go beyond just measuring height and weight. They involve observing a child's behavior, communication skills, and physical abilities. By tailoring our approach, we can create a more comfortable and less intimidating experience for children, fostering trust and cooperation. This, in turn, leads to more accurate assessments and better health outcomes. In the following sections, we'll delve into the specific techniques and considerations for assessing children at different ages from newborns to adolescents. By understanding these differences, we can empower healthcare providers and parents to work together in ensuring the well-being of every child. The arrival of a newborn brings immense joy and a whole new set of considerations. Newborn assessments are crucial for identifying any potential issues early on. These assessments often begin immediately after birth with the APGAR score, a quick evaluation of the baby's heart rate, breathing, muscle tone, reflexes, and color. Beyond the APGAR score, newborn assessments involve a head-to-toe physical examination. Doctors check for birthmarks, reflexes, and any signs of jaundice. They listen to the baby's heart and lungs and examine the hips for proper development. Newborns communicate primarily through cries, so healthcare providers pay close attention to the different types of cries and what they might indicate. One key aspect of newborn assessments is checking for developmental milestones. These include things like sucking and grasping reflexes, as well as the ability to focus on faces. Premature babies may reach these milestones later than full-term babies, so adjustments are made based on the baby's due date. Parents play a vital role in these assessments by sharing any concerns they have about their baby's feeding, sleeping, or overall behavior. Early identification of any issues is crucial for newborns, as interventions are often most effective when started early. Newborn assessments provide a baseline for future checkups, allowing healthcare providers to track the baby's growth and development over time. As babies transition from newborns to infants, their development accelerates rapidly. Infant assessments focus on monitoring this growth and identifying any developmental delays. These assessments typically involve measuring the infant's weight, length, and head circumference, which provide important clues about their overall health. Doctors also assess the infant's gross motor skills, such as rolling over, sitting up, and crawling. They observe the infant's fine motor skills, like reaching for objects and transferring objects from one hand to the other. Language development is another important area of focus, with healthcare providers checking for babbling, responding to their name, and understanding simple instructions. Infants communicate through a combination of cries, coos, and body language. Healthcare providers pay attention to these cues to understand the infant's needs and assess their well-being. For example, excessive crying could indicate colic, while a lack of eye contact might be a sign of a developmental delay. Parents are valuable partners in these assessments, providing insights into their infant's daily routines and behaviors. Regular infant assessments are crucial for ensuring that babies are meeting their developmental milestones and receiving any necessary interventions. Early detection and intervention can make a significant difference in a child's long-term health and well-being. Toddlers are known for their boundless energy and newfound independence, which can make assessments both challenging and rewarding. These assessments require patience, flexibility, and a playful approach to engage the toddler's attention. Healthcare providers often use toys and games to make the experience more enjoyable for the child. Physical examinations for toddlers may involve measuring their height, weight, and body mass index. Doctors also assess their gross motor skills, such as walking, running, and climbing stairs. Fine motor skills, like scribbling with crayons and stacking blocks, are also evaluated. Language development continues to be a key focus, with healthcare providers checking for vocabulary growth, sentence formation, and the ability to follow simple instructions. Toddlers are beginning to assert their independence, which can sometimes manifest as resistance to examinations. Healthcare providers use age-appropriate language and explanations to help the toddler understand what's happening. They may also involve the parent in the examination, allowing the toddler to feel more secure and comfortable. Toddler assessments are a crucial part of ensuring that children are developing appropriately and receiving any necessary support. By creating a positive and engaging experience, healthcare providers can build trust with toddlers and their families, paving the way for ongoing health and